The human body represents a masterpiece of biological engineering, a complex network of systems that communicate silently beneath the surface of our awareness to maintain a state of equilibrium known as homeostasis. For the aging population, the maintenance of this equilibrium becomes increasingly precarious as physiological resilience naturally diminishes over time. Among the myriad challenges facing the elderly, anxiety is often mischaracterized purely as a psychological or emotional reaction to life circumstances, such as isolation, health concerns, or the grief of losing loved ones. However, contemporary neuroscience invites us to reframe anxiety not merely as a state of mind, but as a distinct physiological state rooted in the autonomic nervous system. Specifically, it is a manifestation of an imbalance between the sympathetic nervous system, which drives the fight or flight response, and the parasympathetic nervous system, which governs the rest and digest mechanisms. Central to this balancing act is the vagus nerve, the 10th cranial nerve and the longest, most complex nerve of the parasympathetic nervous system. Understanding the anatomy and function of this wandering nerve is the prerequisite for grasping how self-massage acts as a potent biological switch to dampen anxiety instantly. This article explores the deep scientific underpinnings of vagal tone, the impact of aging on autonomic function, and the physiological legitimacy of somatic touch as a therapeutic intervention. To appreciate the mechanism of self-massage, one must first visualize the architecture of the vagus nerve. Originating in the medulla oblongata of the brainstem, it meanders down through the neck, passing the carotid arteries and jugular veins, branching out to innervate the larynx, pharynx, and vocal cords, before continuing into the thorax to regulate the heart and lungs, and finally extending deep into the abdomen to oversee the digestive tract. It is the primary information superhighway between the brain and the body, carrying a vast amount of data. Interestingly, approximately 80% of its fibers are afferent, meaning they transport signals from the internal organs back to the brain. This is a critical distinction for the elderly population suffering from anxiety. It implies that the brain's perception of safety or danger is heavily dictated by the signals it receives from the body. When the body is tight, breathing is shallow, or digestion is poor. Common complaints in advancing age. The vagus nerve transmits a signal of distress to the brain, perpetuating a cycle of anxiety. Conversely, manipulating the body through targeted touch can send a signal of safety upward, effectively tricking the brain into a state of calm. This bidirectional communication is the foundation of the bottom-up approach to mental health, which is often more effective for seniors than top-down cognitive therapies, as physiological degradation in older age requires physiological solutions. As we age, a phenomenon known as the decline of vagal tone occurs. Vagal tone acts as a biological brake on the heart. In a healthy, youthful system, the vagus nerve exerts a constant, inhibitory influence on the sinoatrial node, the heart's natural pacemaker, keeping the resting heart rate low and allowing for high heart rate variability, HRV. HRV is the variation in the time interval between consecutive heartbeats and is the gold standard biomarker for physiological resilience and emotional flexibility. High HRV indicates a responsive vagus nerve that can quickly calm the body after a stressor. However, in the geriatric population, vascular stiffness, reduced elasticity of tissues, and the cumulative oxidative stress of decades lead to a gradual withdrawal of this vagal brake. The result is a sympathetic dominance where the baseline state of the body shifts toward chronic, low-grade hyperarousal. This explains why an elderly individual might feel a sudden onset of heart palpitations, nervousness, or a sense of impending doom without a clear external trigger. The neurological braking system is simply worn down. Therefore, the introduction of external stimulation through self-massage is not merely a luxury or a relaxation technique. It is a necessary manual override to reactivate a sluggish neural pathway that has lost its automatic efficiency. The science behind why massage activates this pathway lies in the skin's neuroanatomy. The skin is not just a protective barrier, but a vast sensory organ embedded with various mechanoreceptors, such as Pacinian corpuscles and Ruffini endings, which detect pressure and vibration. When specific areas of the body, particularly those rich in vagal innervation like the neck, ears, and chest, are stimulated with slow, rhythmic pressure, these receptors send signals to the nucleus tractus solitarius in the brainstem. This stimulation triggers the release of acetylcholine, the primary neurotransmitter of the parasympathetic nervous system. Acetylcholine binds to receptors on the heart muscle to slow the heart rate and acts as a tranquilizer for the nervous system, counteracting the effects of cortisol and adrenaline. Furthermore, safe and soothing touch stimulates the release of oxytocin, often called the bonding hormone, which has been shown to inhibit the activity of the amygdala, the brain's fear center. For an older adult living alone who may experience skin hunger or a lack of physical contact, the biochemical impact of self-massage is profound. It artificially replicates the physiological reassurance of social bonding, lowering blood pressure and reducing the subjective feeling of loneliness that often fuels anxiety. It is also crucial to address the systemic inflammation that accompanies aging, often referred to as inflammaging. Chronic anxiety and sympathetic dominance exacerbate inflammation by triggering the immune system to release pro-inflammatory cytokines. The vagus nerve plays a vital role in the cholinergic anti-inflammatory pathway, a reflex mechanism that detects peripheral inflammation and suppresses it. By manually stimulating the vagus nerve, we are theoretically enhancing this reflex, helping to lower systemic inflammation. This creates a virtuous circle. Reduced inflammation leads to less pain and discomfort in the joints and muscles, which in turn reduces the distress signals sent back to the brain, thereby lowering anxiety. Thus, the act of self-massage touches upon the very core of psychoneuroimmunology, bridging the gap between the nervous system, the immune system, and emotional well-being. This is not magic. It is mechanotransduction, the conversion of mechanical force, massage, into biochemical signals. We must also consider the diaphragm. The vagus nerve passes through the diaphragm to reach the abdomen. As age decreases lung elasticity and muscle strength, breathing often becomes shallower and more apical, chest-based, which fails to stimulate the nerve. Massage techniques that target the intercostal muscles and the abdominal region can help loosen the rib cage, encouraging diaphragmatic excursion that naturally massages the vagus nerve from the inside out with every breath. In summary of the biological landscape, anxiety in the elderly is a complex physiological state characterized by low vagal tone, reduced heart rate variability, sympathetic dominance, and chronic inflammation. The vagus nerve is the critical lever we must pull to reverse these conditions. While pharmaceuticals can address chemical imbalances, they often come with side effects that are poorly tolerated in seniors, such as dizziness or cognitive decline. Self-massage offers a pharmacological-free intervention that directly targets the autonomic nervous system's hardware. By understanding that the skin is a gateway to the brainstem and that pressure receptors can trigger a cascade of calming neurotransmitters, we validate self-massage not as an alternative therapy, but as a grounded, neuroscientific protocol for emotional regulation. As we transition into the practical applications in the following sections, keep in mind that the objective is not deep tissue manipulation or breaking down muscle knots, which can be damaging to fragile senior skin and blood vessels. Rather, the goal is neuromodulation, using precise, gentle, and rhythmic touch to speak the language of the nervous system, convincing the ancient survival-oriented parts of the brain that the body is safe, secure, and at peace. This understanding changes the intention behind the movement, transforming a simple rub into a medical-grade intervention for mental health. Having established the profound neurobiological imperative for activating the parasympathetic nervous system in the aging body, we must now transition from theory to the practical application of somatic manipulation. The objective here is to map the specific anatomical landscapes where the vagus nerve acts as a superficial interface, allowing us to modulate internal states through external touch. Unlike general massage therapy, which targets muscle fibers and fascia to release lactic acid or structural tension, vagal self-massage is a precision discipline. It is akin to tuning a delicate instrument rather than reshaping the wood. For the elderly individual, whose skin may be friable and whose vasculature may be compromised by atherosclerosis, the mantra for this practice is less is more. The vagus nerve does not respond to aggression or force. It responds to safety, rhythm, and gentle sustained contact. We will systematically traverse the body's vagal zones, beginning with the most accessible and surprisingly potent entry point, the ear, descending through the precarious geography of the neck and settling into the emotional center of the thorax. The human ear is an anatomical marvel, often overlooked in the context of anxiety regulation, yet it serves as the primary portal for non-invasive vagus nerve stimulation. It is the only place on the human body where the vagus nerve has a cutaneous branch, meaning it sends fibers directly to the surface of the skin. This area, known specifically as the auricular branch of the vagus nerve, ABVN, innervates the conchus, the deep, cup-like hollow of the outer ear, and the auditory canal. In clinical settings, transcutaneous vagus nerve stimulation, TVNS, devices clip onto the ear to deliver electrical impulses for treating epilepsy and depression. However, manual stimulation can achieve a comparable, albeit subtler, effect. For a senior experiencing a surge of anxiety, the immediate protocol involves the auricular release. This begins by locating the cymba conchae, the upper hollow of the ear, just above the ridge that separates the ear into two halves. Using the index finger, one applies gentle, circular pressure here. The movement should not be vigorous friction, but a slow, intentional rotation that moves the skin over the cartilage. This mechanical pressure depolarizes the nerve endings, sending an immediate afferent signal to the nucleus of the solitary tract in the brainstem. Many individuals report an involuntary sigh or a yawn within minutes of this stimulation, a definitive physiological marker that the parasympathetic system is engaging and the rest and digest mode is overriding the sympathetic drive. Expanding outward from the conchus, we move to the tragus, the small flap of cartilage covering the ear canal. The tragus is densely populated with vagal fibers. A highly effective technique involves placing the index finger inside the ear canal, gently, without occlusion, and the thumb on the outer tragus, creating a pincer grip. By gently pulling the ear down and out while massaging the tragus, we accomplish two things. We stimulate the nerve directly, and we stretch the fascia connecting the ear to the deep neck structures. This is particularly relevant for older adults who often suffer from temporomandibular joint, TMJ, issues or tension headaches. The vagus nerve passes perilously close to the jaw joint, and chronic clenching, a common subconscious reaction to anxiety, can entrap the nerve. Releasing the ear and the jaw simultaneously signals the brain that the threat has passed. This ear-to-brain loop is the fastest route to physiological deceleration, acting as an emergency brake for a racing heart or spinning mind. Descending from the cranium, we enter the most critical and complex zone of vagal massage, the neck. This region requires the utmost caution and respect, particularly in an older demographic where the integrity of the carotid arteries is a primary concern. The vagus nerve travels within the carotid sheath, bundled alongside the internal jugular vein and the carotid artery. It lies deep to the sternocleidomastoid, SCM, the thick rope-like muscle that runs from behind the ear down to the collarbone. In many seniors, the SCM is chronically hypertonic due to the forward head posture associated with kyphosis or the habitual looking down at screens and books. A tight SCM can compress the vagus nerve, reducing its efficiency. However, one must never massage the front of the neck aggressively or press directly on the carotid artery, as this can dislodge plaques or trigger the carotid sinus reflex, leading to a dangerous drop in heart rate. The safe, therapeutic approach is to focus on the posterior and lateral aspects of the SCM muscle, To perform the SCM decompression, one must turn the head slightly to the opposite side to make the muscle protrude. Instead of pressing in, the technique involves gently pinching the muscle belly with a soft pincer grasp and lifting it away from the underlying structures. This lift and roll motion separates the muscle fibers from the carotid sheath, creating space for the nerve to glide freely. It is a liberation technique rather than a compression technique. As we work our way down the muscle from the mastoid process behind the ear towards the clavicle, the focus remains on hydration and mobility of the tissue. This action stimulates mechanoreceptors that lower sympathetic tone. Furthermore, this area serves as a junction for lymphatic drainage. By gently stroking downwards from the ear to the collarbone with a feather-light touch, no heavier than the weight of a nickel, we encourage the drainage of metabolic waste from the brain. A congested lymphatic system can contribute to brain fog and lethargy, often comorbid with anxiety in the elderly. Therefore, this next sequence is dual purpose. It frees the vagus nerve from muscular entrapment and clears the neurotoxic buildup that clouds cognitive function. Continuing the descent, we arrive at the thorax and the clavicular region. The vagus nerve passes behind the clavicles and branches into the recurrent laryngeal nerves before diving into the chest to innervate the heart and lungs. The clavicular tap is a technique that leverages the principle of vibration to stimulate these underlying pathways. Using loose fists or fingertips, one can gently tap along the collarbone and the upper sternum. This percussive vibration penetrates deeper than surface touch, reaching the mediastinum where the vagus nerve interacts with the cardiac plexus. This area is often referred to emotionally as the heart center, and biologically, it is where emotional stress physically manifests as heaviness or tightness. Gentle tapping here, often accompanied by a hum or a low-tone vocalization, utilizes the physics of resonance. Since the vagus nerve innervates the vocal cords, the vibration of humming stimulates the nerve from the inside, while the tapping stimulates it from the outside. This sandwiching of a nerve with vibration is incredibly soothing for the senescent nervous system, which may have lost some of its sensitivity to lighter touch. Deep within the chest lies the thymus gland, situated just behind the sternum. While the thymus atrophies with age, the area remains a convergence point for neurovascular structures. A soothing technique, known as the sternal glide, involves placing the flat of the hand on the center of the chest, skin to skin if possible, and waiting for the heat of the hand to penetrate the tissues. Once the connection is established, the hand slowly glides downwards with the exhale. This downward pressure mimics the biomechanics of a sigh, physically depressing the rib cage and encouraging the exhalation of residual air. In elderly lungs, air trapping, the inability to fully exhale, is common and leads to hyperinflation, which mimics the feeling of panic. By mechanically assisting the chest to fall, we send a feedback signal to the brainstem via the vagus nerve that breathing is slow and controlled. This links the tactile sensation directly to respiratory mechanics. The chest wall in seniors can become rigid due to the calcification of costal cartilages. Thus, keeping this area mobile through gentle massage and directional pressure is essential for maintaining the elasticity required for deep, vagal stimulating breaths. The transition from the chest to the diaphragm marks the border between the somatic and the visceral. The diaphragm is the primary engine of vagal tone. The vagus nerve pierces through the diaphragm alongside the esophagus to reach the stomach. If the diaphragm is tense or immobile, a frequent consequence of shallow, anxiety-driven chest breathing, the nerve is essentially strangled at this hiatus. Self-massage here involves locating the lower edge of the rib cage. The fingers gently hook under the ribs without causing pain, while the individual leans slightly forward. This diaphragmatic release is performed strictly during exhalation. As the air leaves the lungs, the diaphragm relaxes and moves upward, allowing the fingers to massage its attachment points. This is an advanced maneuver that requires sensitivity. For a senior audience, A safer modification is the solar plexus soothe. Using the palm of the hand to make slow, clockwise circles in the soft area just below the sternum effectively stimulates the celiac plexus, a dense network of nerves heavily fed by the vagus. This circular motion follows the path of the colon, aiding digestion, which is often arrested during anxiety, but primarily it warms and relaxes the upper abdomen, signaling the parasympathetic system that it is safe to digest and relax. It is imperative to understand that these techniques, the ear rotation, the SCM lift, the sternal glide, and the abdominal circle, are not isolated actions. They are components of a continuous biological circuit. The efficacy of self-massage lies in the fluidity of connecting these zones. One does not simply press a button on the ear and expect a miracle. One cultivates a wave of relaxation that washes down from the cranium to the core. The sequence is designed to follow the anatomical path of the nerve itself, originating in the brain, conducting through the neck, regulating the heart, and resting in the gut. By tracing this path with our hands, we are essentially tracing the line of communication between the mind and the body, manually clearing the static on the line. Furthermore, we must address the medium of touch. For aging skin, which produces less oil and has a thinner dermis, friction is the enemy. The use of a high-quality oil or lotion is not merely cosmetic, it is functional. It prevents the dragging of skin, which can damage superficial capillaries and cause bruising. But beyond the mechanics, the application of a lubricant adds a sensory dimension of self-care. The act of caring for one's own skin is in itself a vagal stimulant. It fosters a sense of self-compassion, counteracting the self-critical or fearful thoughts that drive anxiety. The temperature of the hands is also a variable. Cold hands can trigger a sympathetic recoil response. Warming the hands or the oil before application is a necessary preparatory step to ensure the nervous system remains receptive rather than defensive. In the final analysis of the technique, we must consider the duration and frequency. Unlike a muscular workout where intensity drives change, neuromodulation relies on consistency. A massive, deep tissue intervention once a month does little for vagal tone. However, 5 minutes of gentle auricular and cervical stimulation performed twice daily, perhaps upon waking and before sleep, can rewire the autonomic baseline over time. This concept of neuroplasticity persists well into old age. The nervous system is always learning. By repeatedly pairing these specific touch protocols with a state of calmness, the senior is essentially teaching their body a new default setting. We are conditioning the body to associate the touch of the hand on the chest or the neck with safety, eventually creating a Pavlovian response where the mere act of placing a hand on the heart can instantly drop blood pressure and quell a panic attack. This is the ultimate goal of self-massage, to build a physiological reservoir of safety that can be accessed at a moment's notice, granting the elderly individual autonomy over their own emotional landscape. We have now traversed the physiological terrain of the anxiety response and mapped the anatomical keys that unlock the parasympathetic nervous system. However, understanding the isolated mechanisms of the ear, the neck, and the abdomen is akin to knowing the individual notes of a musical composition without hearing the symphony. The true potency of self-massage lies not in the disjointed application of these techniques, but in their integration into a cohesive, rhythmic ritual that synchronizes with the body's most fundamental biological rhythm, the breath. In this final analysis, we must explore how to thread these localized interventions together using respiration as the conductive medium, creating a systemic shift that extends far beyond the moment of massage to reshape the aging brain's resilience through neuroplasticity. The catalyst that transforms a simple massage into a neurological intervention is a physiological phenomenon known as respiratory sinus arrhythmia, RSA. Despite its clinical-sounding name, RSA is a healthy, natural fluctuation in heart rate that occurs during the breathing cycle. When we inhale, the vagus nerve's inhibitory brake is temporarily lifted, allowing the heart rate to accelerate slightly to oxygenate the blood. Conversely, when we exhale, the vagus nerve re-engages, slowing the heart rate down. This is the biological window of opportunity. To maximize the anti-anxiety effects of self-massage, the tactile pressure must be synchronized with the exhalation phase. This is when the vagus nerve is most receptive to stimulation. Therefore, the master protocol for the elderly individual is to pair the downward strokes, the slide down the neck, the depression of the chest, the circular release of the belly, with a slow, elongated exhalation. This synchronization creates a force multiplier effect, sending a double signal of safety to the brainstem. One from the mechanoreceptors in the skin and one from the baroreceptors in the lungs. Let us construct a narrative of practice, a guided visualization of how a senior might implement this science into a daily routine to combat an episode of acute anxiety. Imagine the individual seated in a chair that supports the spine, feet flat on the floor to establish proprioceptive grounding. The session does not begin with touch, but with the physiological sigh, a double inhale through the nose followed by a long, audible exhale through the mouth. This resets the carbon dioxide levels in the blood. As the breathing stabilizes, the hands are warmed, friction generating heat, and placed over the eyes. This palming initiates the oculocardiac reflex, a lesser-known vagal pathway where gentle pressure on the eyes lowers heart rate. From this darkness, the hands move to the ears. The fingers find the concus and the tragus. With a slow exhale, the rotation begins. It is not just rubbing. It is an intention of tuning out the noise of the world and tuning into the internal hum of the body. The sensation travels from the outer ear down the auditory canal, signaling the brain to dampen the auditory hypersensitivity that often accompanies anxiety states. Flowing seamlessly from the ears, the hands drift down to the neck, finding the sternocleidomastoid muscle. Here, the movement syncs strictly with the breath. As the senior inhales, the hands rest statically, waiting. As the exhalation begins, the fingers gently drag down the lateral neck, draining the lymph and decompressing the vagus nerve. This is repeated 3 times, each pass slower than the last. The hands then cross over the chest, right hand to left shoulder, left hand to right shoulder in a self-embrace. This is not merely a comforting gesture. It mimics the containment of being held, triggering the release of oxytocin. The fingertips tap rhythmically on the clavicles, a drumbeat of safety, while the voice engages in a low hum. The vibration of the hum travels through the skeletal structure, shaking loose the tension in the mediastinum, massaging the vagus nerve from the inside out. Finally, the hands settle on the solar plexus. The movement becomes a slow, clockwise circle, matching the pace of the digestion. The mind visualizes the diaphragm moving like a jellyfish, floating up and down, unkinking the nerve with every cycle. This entire sequence, performed in under 10 minutes, acts as a systemic reboot, flushing cortisol from the system and reinstating the dominance of the parasympathetic state. The implications of such a practice extend far beyond the immediate relief of a panic attack. We are speaking of neuroplasticity, the brain's ability to reorganize itself by forming new neural connections. For a long time, science believed the aging brain was fixed, destined only for decline. We now know this is false. The nervous system retains the capacity to learn until the very end of life. By practicing vagal self-massage regularly, the elderly individual is essentially exercising the vagus nerve. Just as a bicep grows stronger with weightlifting, the vagal tone increases with repeated stimulation. This means that over time, the baseline state of the nervous system shifts. The threshold for what triggers anxiety becomes higher, and the ability to bounce back from stress becomes faster. This is the cultivation of physiological resilience. A senior with high vagal tone is not just calmer. They're biologically younger. Their inflammation levels are lower, their digestion is more robust, and their glucose regulation is more stable. Furthermore, the benefits cascade into the realm of sleep architecture. Sleep fragmentation is a scourge of the elderly, often driven by a nervous system that cannot fully power down at night. The vagus nerve is the gateway to deep, restorative non-REM sleep. Performing the ear and neck massage routine prior to bed lowers the core body temperature and slows the metabolic rate, preparing the body for the transition into unconsciousness. Better sleep leads to better clearance of beta-amyloid plaques in the brain, the proteins associated with Alzheimer's disease, via the glymphatic system. Thus, we can argue that vagal self-massage is a neuroprotective strategy, preserving cognitive function by ensuring the brain gets the rest it requires to clean itself. We must also consider the psychological dimension of agency. One of the most debilitating aspects of aging is the perceived loss of control over one's mobility, health, and environment. Anxiety often stems from this feeling of helplessness. By teaching seniors that they possess an internal pharmacy and the manual tools to access it, we restore a sense of autonomy. They are no longer passive victims of their racing hearts or shallow breath. They are active operators of their own physiology. This shift in mindset is transformative. When an elderly person realizes, I can change how I feel with my own hands, the fear of the anxiety itself diminishes. The loop of fear is broken. In conclusion, the practice of self-massage to activate the vagus nerve is a convergence of ancient wisdom and modern neuroscience. It is a testament to the incredible design of the human body, which carries within it the cure for its own distress. For the aging population, who may feel betrayed by a body that seems to be failing, this knowledge offers a reconciliation. It reframes the body not as a source of pain, but as a vessel of immense potential for peace. We have explored the anatomy, the technique, and the profound biological ripple effects of this practice. It is simple, safe, free, and instantly effective. It requires no equipment, only the gentle, knowing touch of one's own hands. As we close this exploration, let us remember that the goal is not to stop the aging process, but to inhabit our bodies with grace, reducing the noise of the sympathetic nervous system so that we may hear the quieter, deeper rhythms of life. The vagus nerve is listening. We need only learn the language of touch to speak to it.